Hi, my name is Van Moy, and this is my global health presentation. I picked South Korea, which is an East Asian nation that occupies the south portion of the Korean peninsula. First, let's talk about 5 health concerns in South Korea. This includes tuberculosis, which is also called TB. According to the Global TB Report in 2021, South Korea still has the highest incidence of TB with 49 per 100,000 population and the third highest TB mortality rate with 3.8 per 100,000 population. Also, lung cancer is the leading cause of cancer death in both sexes in South Korea. The overall accrued incidence rate was 52.7 per 100,000 population. Another cause of death in South Korea is colorectal cancer. South Korea had the second highest incidence rate of colorectal cancer in 2018, with the rate estimated to be 44.5 cases per 100,000 persons per year. On the right here, I have a picture of TB and the two cancers, lung cancer and colorectal cancer. Furthermore, South Korea's health concern is air pollution. Multiple studies have shown that most of South Korea's pollution comes from China because of the spread of yellow dust produced by China's factories and coal-fired power plants. According to Center for Economic and Policy Research, in February of 2023, an increase in air pollution from China resulted in an increase in annual mortality in South Korea by 31.2 per million people. Last but not least, suicide is the sixth leading cause of death in 2022, with 26 deaths per 100,000 population. Elderly men had the highest suicide rate, but the rise in suicides among adolescents and the youth due to mental health problems is another worrisome development. Moving on, the main health concern that I have chosen to investigate is tuberculosis, as this is unique to South Korea and we don't typically see it in the US. With the help of health departments and CDC control efforts to prevent the development of TB disease. I will now discuss the epidemiological triad of agent, host, and environment for TB. TB is caused by a bacterium called Mycobacterium tuberculosis, and this is the agent. To the right, I have provided a picture of the bacteria. The bacteria usually attacks the lungs, but TB bacteria can attack any parts of the body, such as the kidney, spine, and brain, though not everyone infected with TB bacteria becomes sick. TB strains are more virulent than others with higher morbidity and mortality in infected individuals. Most cases of TB are durable. However, drug-resistant TB is more difficult to cure because the medications normally used to treat the infection don't work. This type of bacterial resistance could increase the risk of death from TB, making early diagnosis critical. Next is the host, which are people without specific immunity. So generally, normal children and young adults who have not previously been exposed to Mycobacterium tuberculosis. The initial infection can occur at any time during childhood, but adolescence is the peak time of risk. The risk of TB susceptibility and mortality is significantly increased in individuals aged 65 and older. Last is the environment in which TB can be transmitted and worsen due to the environmental factors. TB has been linked with environmental risk factors that go hand in hand with poverty, and these include overcrowded living conditions, poor ventilation, and bad sanitation. Because TB is spread through the air from person to person, close contact is a factor that contribute to the spread of TB, as people nearby may breathe in these bacteria and become infected. TB is also common in facilities like prison because the people are living in congregate settings, which increases the risk of infection. Here you can see a picture of a prison, and the people are all gathered together, so their environmental condition is a risk factor for TB. On the next slide, we're going to talk about the social determinants of health. They are grouped into 5 domains, such as economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. I will relate these to my identified health problem, which is tuberculosis. First off is economic stability, and this includes poverty. As I have mentioned before, tuberculosis and poverty goes hand in hand with each other because TB is more common in countries where people live in absolute poverty, like some areas in South Korea. Also, because of poverty, people are likely to live and work in poorly ventilated and overcrowded conditions, which makes it easier for the TB bacteria to spread. Second, with education access and quality, poverty still plays a role, and because of the lack of general health knowledge and the lack of empowerment to act on it, there is an increased risk of TB exposure because of unpresent education about HIV, smoking, and alcohol abuse. Third is healthcare access and quality, and this is important with infections like TB because the poor and vulnerable groups face barriers to access both health and TB services, and so TB is not able to be controlled. With improved access to health services, people with TB can adhere to recommended treatment. Undernutrition and poor nutritional status is also a risk factor for developing active disease. Without healthcare access, a person is not able to meet sufficient intake of energy and nutrients and maintain good health. And this is vital, especially with TB. Fourth is neighborhood and built environment. Overcrowding is a risk factor for TB exposure, transmission, and drug resistance. So, improving environment and living conditions in prisons and other congregate settings will help lessen the spread of TB, as well as promoting health and safety within the neighborhood and environment. Last, the fifth is social and community context. Social issues like poverty enhances the transmission of TB through its influence on living and working conditions. And so increasing social and community support for low income communities can help tackle the spread of TB. On the right here, we have a picture of South Koreans in Seoul uniting to come together and build as a community. Next up, I will talk about levels of prevention for tuberculosis. Primary prevention include vaccination for TB, and it is called the Bessel Calmette-Guerin vaccine. This vaccine is not widely used in the United States, but it is often given to infants and small children in other countries where TB is common. In South Korea, the policy is to give BCG vaccination within the first month of birth, along with revaccination given to some elementary children aged 6 to 7 years. Secondary prevention for tuberculosis is screening and early diagnosis, such as tuberculin skin tests and IGRAs, which are whole blood tests that can diagnose the bacterium of tuberculosis infection. Both of these screenings are being done in South Korea as well as globally. Tertiary prevention for tuberculosis is the treatment of people who have already developed the disease. So treating patients with active TB is important, as well as assuring a hygienic condition of environment and follow-up of the previous confirmed treated patients for a period of at least 6 months. On the right, I have a picture of the BCG vaccine, and down below here is what a skin test for TB looks like. So, in conclusion, TB incidence in South Korea had been stagnant today with successful implementation of Korea's TB control policy. In order to eliminate TB, South Korea is screening those at high risk of TB and their families and is providing necessary treatment. What is being done in South Korea for TB fit into the 17 sustainable developmental goals of the United Nations because South Korea has a TB elimination plan that includes ramping up TB information campaigns, strengthening the country's health infrastructure, and investing in health personnel, which all are actions that are set in the Sustainable Developmental Goals. Here is my references slide. Thank you, and I hope